You are watching this video as you've been placed on the waiting list for a total knee replacement. The Enhanced Recovery Program at the Homerton is designed to improve your hospital experience and aims to ensure that you return to normal as soon as possible. We want you to play an active role in your care, and we've therefore created this video to fully prepare you for your forthcoming surgery. In the UK, more than 50,000 knee replacements are performed annually and have been in use since the 1970s. The operation aims to alleviate pain due to knee arthritis. In addition, the operation can improve your mobility and quality of life. Osteoarthritis of the knee occurs when the cartilage, which is a smooth surface covering the joint, becomes worn out. Cartilage does not readily heal, so over time, the quality and depth of cartilage reduces. This results in a narrowed and irregular joint space. It's this process which is responsible for causing your pain. Following being listed for knee replacement surgery, you will have a number of appointments prior to your operation, the most important of which is the anesthetic pre-assessment held in the surgical center. The purpose of this is to assess your general health and medications prior to having an anesthetic and undergoing surgery. Some of the medications may need to be stopped or altered. The pre-admission staff will explain whatever needs to be done in your particular instance. Additionally, you'll be asked to attend joint school at the Homerton, which is a 90-minute group session on joint replacement education. This is approximately 4 weeks prior to your operation. At this meeting, you will have the opportunity to ask questions to the nurses, occupational therapists, and physiotherapists involved in your care. At joint school, you will also be able to meet other patients undergoing the same operation as you. You will be advised on preoperative knee exercises, which are designed to mobilize the arthritic knee and strengthen surrounding muscle groups prior to your surgery. You should try and eat healthy, balanced diet in the weeks leading to your surgery, as this has been shown to enhance recovery. If you are a smoker, we advise you to stop smoking at least 2 weeks before your hospital admission and maybe 6 to 8 weeks after, as this will reduce your chances of complications. Please inform our specialist nurse, Janice Dorset, or your GP if you require assistance with this. On the day of surgery, do not eat food for 6 hours before you come to hospital for your surgery. However, you may drink non-fizzy water for up to 2 hours. You'll be given a pre-op energy drink that needs to be consumed before 6:30 a.m. on the day of your surgery. We also recommend you have a shower prior to coming to hospital to ensure your skin is as clean as possible to reduce the chance of having an infection. On the day of surgery, you will be admitted to the surgical center where you'll be seen by an anesthetist to discuss the options available for pain relief. You will either be completely asleep during the operation or have the nerves that supply your lower half of your body numbed for a few hours. This could either be done with an epidural or a spinal injection. Additionally, you will meet a member of the orthopedic team who will require you to sign a consent form to ensure you understand what the surgeon is planning to do and the potential risks. They will place a mark around the joint being operated on. The operation essentially involves removing the arthritic bone surfaces of the thigh bone, that's the femur, and of the shin bone, the tibia. They are replaced with stainless steel components held with cement. There will be a plastic spacer sitting in between the metal components. Often the kneecap, that's the patellar surface, is also replaced with a plastic button. 95% of knee replacements last more than 10 years. If the damage is just confined to one side of your knee, then you may have been listed for a unicompartmental knee replacement as opposed to a total knee replacement. As with any other surgery, there are risks and complications, although we take every precaution to prevent this. They include bleeding, infection, nerve damage, blood clots in your leg that may travel to your lungs, and the risks of anesthesia itself. We'll go through this in more detail when you sign your consent on the morning of your surgery. When you wake up from surgery, you will be in the recovery room from which you'll be taken either to Thomas Audley ward or to Priestley ward. you'll be placed in the same sex base. A small proportion of our patients will go to the high dependency unit following the operation for closer monitoring and will then subsequently go to our regular wards. All patients receive strong painkillers, anti-sickness medications, and blood thinning injections or tablets regularly following surgery. It is important that you move around as soon as possible following surgery. On the first day, our physiotherapist will help you to transfer from your bed to chair. The following day, the aim is to walk to the end of your bed at least 4 times with assistance. You also have routine blood tests and x-rays on this day. There may be a wound drain in place which will be removed 24 hours after surgery. On day 2 after surgery, we will help you to walk to the end of your bed at least 4 times. And on day 3, to the entrance of the ward 4 times. We'll also help you to walk up and down stairs if you have them at home. You will be encouraged to eat and drink as normal as early as possible. This will include energy supplements, which we will provide. You should be ready to go home on day 4 after surgery, although some patients require longer. You will continue to have physiotherapy sessions for up to 6 weeks following your discharge, and you'll see a member of the orthopedic team in clinic at about 6 or 8 weeks. The doctors and nurses looking after you will advise you on wound care before you go home. By approximately 3 months post-op, you will be largely back to your normal activities, although improvements continue for up to 1 year after the surgery.